if you look at your spreadsheet,
They don't have to be single.
yeah, you would just be overall increasing the deductions for every participant. We have about 40 people on employee-only coverage. Is that about accurate, I would say? That would be, to answer your question, that would be the only other way. We are at the max out-of-pocket allowed by the Affordable Care Act with our plan. So we've taken the deductible up as high as we can.
Okay.
There's nowhere else to really run unless we start looking at some significantly different plan designs.
So you say with charging the employee $25 a month?
$50 a month, $25 a pay period. I'm just using round numbers. If we have, 100 people on the plan, then that's going to be somewhere between $50,000 and $60,000 a year savings, depending upon how many people we have throughout the year enrolled in our plan.
And then this is added to that $37,500.
That's correct.
So we're approaching $100,000 plus the savings. All right. I guess we have a motion and second on the floor. We better vote on that and let it die, hadn't we?
Well, it's not necessary that you let it die. This particular set of circumstances, if you adopt the option 2, if you made the motion on, that would still hold. We'll come back with a second motion to adjust the employee contribution to that.
That's correct.
All right.
And the employee deductions.
Well, you heard Mr. Luke's motion to adopt option 2 with United Healthcare, and did you say that?
I second.
And Mr. Salmon seconded. All in favor of that motion signify by saying aye, or show of your right hand. All opposed, same sign. Now, you want to make your other motion?
If I may, it's $58,500 based on the number of participants we have right now on the deduction amendment.
I want to bring it up for discussion.
Okay, well, let's get it on the floor. Somebody want to make that motion?
All right, I'll make a motion for employee contributions to the tune of $58,500 savings to the county.
Per employee per month is the way we need to do it. Or
Right.
per pay period, I think, actually.
$50.
I would just, $650 a year is what we're looking at. If you take $50 times 26 pay periods, it ends up being $650 a year, so.
Or just,
Is there a second to that motion?
I second it for discussion.
Discussion, okay.
And since we haven't been charging them anything, or haven't been requiring them to do anything, that might be more of a hit than we want to hit initially. So, I think we need to do something, but I don't know that we want to hit them all with $650.
Well, we are doing away with prohibitions.
Well, projected.
Yeah.
Kelly, the increase in the deductible from 1,000 to 2,500, is that a true out-of-pocket for the employee versus this HRA
That's a question.
That is correct.
reimbursement?
That's correct. We have 100% coverage after the deductible is met for in or outpatient care. So any deductible that they have is their max out of pocket for those types of plans. Can I answer your question?
Yeah, I'm just concerned that for that 16 people, that's essentially a $1,500 a year hit.
That's correct.
That's a lot of money. And this comes into play when what? They have a surgery? How is this deductible come into play?
So any in or outpatient claim, and I always explain it, if you go to the doctor, you go to the pharmacy, you go to the ER, you have a copay. Anything outside of that is going to be related to the deductible.
All right. I'll call the question.
Yes.
We have a motion and a second on the floor to increase the deductible by
Increase the
$600.
employee deduction.
The employee deduction by approximately $650 a month. A year, I mean. Lord, it seems like all we've done the last 2 weeks is meet here and talk about budget. A year.
Contribution instead of deduction.
Contribution, yeah. Play on words. We have a motion, we have a second. I'll call the question. All in favor signify by a show of their right hand. All
Still,
Now, we still got the first, we still voted on that. What we're talking about is the additional.
Right, you've already voted to increase the deductible.
Yeah.
Yes.
and change the deductible with $4,000
Now,
deductible.
this is for the additional deduction.
That's right.
Yeah, for discussion.
Yeah.
So in other words, we ain't ready to vote yet. There's still some discussion to be had.
Well, I just called the question and nobody voted. Are we not through with discussion?
Well, we don't have to go with the $650. We can change that.
If you're talking $25 a pay period, what's your alternative?
You gotta vote on this motion at some point.
Yeah.
Please understand, you can make another motion, different. You might want to continue the discussion, Mr. Chairman, on the options before we vote on this one.
Say again.
Continue the discussion regarding other options before they vote on this one.
Yeah.
So,
Let's continue the discussion then.
I don't know what the answer might be, but I think there needs to be some contribution by the employees, but I don't know if we want it to be $650.
Special, well, as Karen said, those 16 people will be penalized. And
They'll do it twice.
it could be more than that,
So, I'm sorry, I missed that part. 16 people we penalized.
that contributed to that, well, the HRA.
There's 16 people that went over the deductible, the $1,000 deductible. So they're gonna be hit, those 16, by raising that deductible. What they're saying is that by,
If they do it again this year.
Right.
yes, and by doing it up to $25 per pay period, it's gonna be hit not only that amount, but additional for those, if you say average of 16.
One option would be cut the deduction increase in half, change it to $12.50 a pay period. That would generate a savings of 29, or it would increase the cost of the employees, save the county money by $29,250. If you add both of those together, it's $66,750 a year savings, which just about gets us to our increase of projected of $68,000.
$15 pay period, that would cover that.
Yeah, you're looking at $25 a month instead of $50.
We went to 15 pay period.
We went to-
That would carry us up enough to cover the increase that we're having.
Completely, yes.
All
I'll
right.
make a motion.
Louis, we got one on the floor we got to vote on. Voting on Mr. Luke's motion, which was to take the $650 total yearly deduction. Contribution, employee contribution. All in favor of that motion, signify by a show of your right hand. All opposed, same sign.
new motion.
Okay, now, is there a new motion on the floor?
I'll make a motion that employees start paying $15 per pay period to help cover the cost of insurance.
All employees.
Individual.
Need to be all tiers, so those that have family coverage are gonna pay $15 more pay period as well.
Same thing for everybody.
That's right.
For employees.
Right, you've heard Mr. Henry's motion, is there a second?
I'll second that motion.
A motion and a second on the floor that all employees will contribute $15 per pay period to the insurance cost. All in favor of that motion signify by a show of your right hand. All opposed, same sign.
There's a motion not being seconded.